Today, we'll discuss the effect of intermittent fasting on heart health and inflammation. My name's Steve, and this is episode 3 of the Intermittent Fasting Research Review. If you have not seen the first 2 episodes, go ahead and check those out when you're finished with this one. I will link those below. So when it comes to intermittent fasting as it relates to risk for cardiovascular disease, we need to keep in mind that intermittent fasting has only been well researched for about the past 10 to 15 years, so we don't have any direct data linking a specific intermittent fasting protocol directly to reduced risk for heart attacks or any other form of cardiovascular disease. Now, with things like physical activity, smoking, alcohol intake, even certain dietary habits, we have decades and decades of data where those types of conclusions can be drawn. But for right now, with intermittent fasting, what we can do is we can look at the effect of intermittent fasting protocols on parameters that we know are strongly related to the development of cardiovascular disease. So risk factors like increased body weight, blood pressure, cholesterol levels, triglycerides, and even markers of inflammation. We'll turn to the cardiometabolic benefits of intermittent fasting, which is the review article by Dr. Varady and colleagues, which was published in the Annual Review of Nutrition. So they examined the effect of alternate day fasting 5-2 protocol and time-restricted eating on different risk factors for cardiovascular disease. So what they looked at was the effect on body weight, blood pressure, cholesterol, triglycerides, insulin resistance, oxidative stress, and inflammation. So in terms of impact on body weight, all 3 intermittent fasting protocols were effective for weight loss, which if you take all 33 studies together and take the average, there's about an average of 4% weight loss over 8 weeks. If you're curious as far as which protocols are most effective for weight loss and fat loss, go ahead and check out last week's episode where we discuss it in detail. For blood pressure, now with blood pressure, you have 2 numbers. You have the top number, which is the systolic pressure. That is the pressure when your heart muscle is contracting and it's pumping blood out to the rest of the body. And then you have the bottom number, which is the diastolic pressure, which is the pressure when your heart is relaxed and refilling with blood. All 3 intermittent fasting protocols were effective in reducing both systolic and diastolic blood pressure by an average of 4 to 9%. With cholesterol, there's 2 types of cholesterol that were studied. You have LDL cholesterol, which is low density lipoprotein that is commonly thought of as the bad cholesterol, as due to its structure and its density, it is more likely to contribute to plaque formations and arterial blockages. What they found is that alternate day fasting and 5-2 protocols were effective in reducing LDL cholesterol by a range of 10 to 23%. So for HDL cholesterol, vast majority of studies showed no change whatsoever. There, interestingly, was one study that showed an improvement, and it was a large improvement, so by 18%. What they did was they combined alternate day fasting with endurance exercise. Now, that's a bit of a confounding factor because we do know that endurance exercise itself can improve HDL. It was a small study. It could very well just be a statistical outlier, but it was interesting because there were 4 groups. One group was simply a control group. They didn't do anything. Okay, the second group followed an alternate day fasting. Third group followed a cardiovascular exercise program. And the 4th group did both the alternate day fasting with the cardiovascular exercise program. Okay, so the combination group was the only group that showed an improvement in HDL, and it was quite a large improvement. If you're curious what the exercise protocol was, what they did was for the first 4 weeks, start with 25 minutes on either treadmill, bike, or elliptical at 60% of their maximal heart rate, and then they progressed to 40 minutes at 75% of their maximal heart rate by week 10. It was a 10-week study. The alternate day fasting group and the exercise only group did not have any improvements in HDL in this case. So this may be a case where combining intermittent fasting with exercise may have a synergistic effect on HDL levels, but we'll have to wait for more data to confirm that. So in terms of triglycerides, triglycerides are fats that are circulating in your bloodstream. We mostly get those for foods, but the body can convert other chemicals into triglycerides as needed. Alternate day fasting and the 5-2 protocol were effective in reducing triglycerides with a range of improvement by between 9 and 17%. There was no effect in terms of time-restricted eating, although interestingly, one study showed a short-term increase in triglyceride levels, but it was the only study to do so. All 3 intermittent fasting protocols were effective in reducing insulin resistance, actually by an average of 27%, which is a huge effect. So insulin resistance can strongly contribute to both cardiovascular disease and diabetes. So insulin is a hormone that's secreted by the pancreas in response to an increase in blood glucose levels or blood sugar levels. And it's one of the body's primary means of regulating blood sugar. So what happens is blood sugar levels go up, insulin is secreted, and that signals to your cells that they need to store glucose. So most of it will be stored in muscle cells as glycogen. And so a reduction in insulin resistance means that your cells are more responsive to insulin and need less insulin present to function normally and regulate your blood sugar levels. Oxidative stress can contribute to chemical reactions that contribute to cellular damage and aging. It occurs when there's an increase in levels of free radicals relative to antioxidants. So there were not any large changes found, but both time-restricted eating and alternate day fasting were found to have a mild beneficial effect in reducing levels of oxidative stress. For whatever reason, the 5-2 diet did not seem to have any effect. For markers of inflammation, the researchers looked at 4 different markers, which included TNF or tumor necrosis factor alpha, interleukin 6, C-reactive protein, and homocysteine. And they found, for the most part, no significant effect in reducing inflammatory markers by fasting alone. There were 2 exceptions. The 5-2 diet had a mild improvement in C-reactive protein, and the alternate day fasting showed a mild reduction in TNF alpha. But this may be a case where what you eat is far more important than when you're eating it. So the authors did note that there were no significant changes to diet quality among intermittent fasting participants. So they didn't change what they ate. In these studies, really, they only changed when they consumed the food. So if they were eating a lot of pro-inflammatory foods like highly processed foods, simple sugars that are known to contribute to inflammation, then that would make sense that there's no reduction in it. So we do know from a nutritional standpoint that certain diets and eating patterns can have an anti-inflammatory effect. So for example, both the ketogenic diet and the Mediterranean diet, even though neither of them incorporates any form of intermittent fasting, they both show reduction in inflammation. And the reason I picked those 2 is just because they're both 2 very different approaches, but what they have in common is that they minimize the intake of highly processed foods and simple sugars. So one more marker of cardiovascular health has not been as well studied overall, but was mentioned in a few articles, is adiponectin. All right, so adiponectin is a protein that is secreted by adipose or fat tissue, and it acts as a hormone. The evidence is conflicting on whether or not intermittent fasting by itself has any effect on adiponectin in humans. There was one interesting animal study that I'll just go over. So it was done in rats, so we don't know if it translates exactly to humans or not. But this was done by Juan and colleagues in 2010, published in the Journal of Nutritional Biochemistry. The paper is called "The Cardioprotective Effect of Intermittent Fasting is Associated with an Elevation of Adiponectin Levels in Rats." What they did was they took two groups of rats, and over a period of 3 months, they put one group of rats on an alternate day fasting diet, and the other group of rats got to eat whatever they want. At the end of the 3 months, they induced a heart attack in the rats, the poor rats. So what they did was they constricted the blood flow to the rat's left coronary artery, which delivers blood to the heart. And what they found was quite interesting. The rats on the alternate day fasting diet had a much lower area of damage in the heart as a result of the heart attack. They still had a heart attack, but the damage was less severe, more concentrated to a smaller area, and the markers of inflammation that were measured afterwards were lower. And they found that this was correlated with an increase in adiponectin, which the researchers concluded had a cardioprotective effect. So we cannot repeat this in humans for obvious reasons. But it is possible that intermittent fasting can improve adiponectin levels, which may be beneficial for heart health. Although, whether or not it's the fasting itself that's improving the adiponectin levels, or fat loss as a result of intermittent fasting, we don't necessarily know, because we know that intermittent fasting can cause fat loss, but we also know that adiponectin levels are inversely correlated with body fat levels. So someone who is obese will tend to have low levels of adiponectin, whereas someone who has a healthier body composition, lower body fat percentage, tends to have higher levels of adiponectin. Thank you for watching. If you've tried intermittent fasting yourself, or if it's something that you're currently trying, go ahead and post in the comments below. Let me know how it's going. Let me know if you're having any challenges. If you have any questions about the content or any suggestions for topics, go ahead and post those below. I will respond to every single question. And join us next week for a discussion on intermittent fasting as it relates to muscle mass, hormones, and immune health.